Thank you. Joining us for this announcement about Selkirk Regional Health Centre, we welcome the Honourable Premier Heather Stefanson. Thank you. Joining us for this announcement about Selkirk Regional Health Centre today, we welcome the Honourable Premier Heather Stefanson and the Honourable Audrey Gordon, Minister of Health and Seniors Care and Mental Health, Wellness and Recovery. Before we carry on with our programme, I'd like to acknowledge the Interlake Eastern Regional Health Authority delivers healthcare services on First Nations Treaty Territories 1, 2, 3 and 5, and on the homeland of the Métis Nation. We respect that First Nations treaties were made on these territories, acknowledge harms and mistakes, and we dedicate ourselves to collaborate in partnership with First Nations, Inuit, Métis peoples in the spirit of reconciliation. I'd now like to introduce the Honourable Audrey Gordon, Minister of Health and Seniors Care, Mental Health, Wellness and Recovery. Thank you.
Good morning, everyone. Thank you all for joining us today. We have many distinguished guests here, and it's such a pleasure to be here in Selkirk. Good morning to Premier Heather Stefanson, and just want to congratulate our Premier on the amazing State of the Province address that she delivered earlier this week. It was good to be in a sold-out audience and to hear the Premier talk about her plans for our province going forward. And one of those plans is what we're here to announce today. So thank you, David, also for the introduction. I'd like to take this opportunity to just pause and thank our healthcare providers and staff across the province, including those here at the Selkirk Regional Health Centre. And they have worked extremely hard to continue to provide quality care throughout this pandemic. I'm excited to be here, as I said, for this announcement that I'm sure will improve quality of care for all Manitobans, not only now, but well into the future. Investing in healthcare services and communities throughout the province will not only improve the physical health and well-being of Manitobans, but their mental health as well. Our government's investment at Selkirk Regional Health Centre is an investment in the improvement of patient care for people living in the community and the health region. By improving services in Selkirk, we are supporting the delivery of more healthcare services that are more convenient for patients living in this area. This announcement today is part of Manitoba's Clinical and Preventative Services Plan, which was developed and led by clinical leaders and health system experts across the province. Detailed planning looked at population growth and community health needs, distance to specialized health services, and the stability and reliability of the province's health workforce. I'm extremely happy to be part of the exciting time for Selkirk Regional Health Centre, and with that, I'll now pass it over to Premier Stefanson.
Thank you very much, Minister, for those opening comments. Mr. Mayor, Your Worship, colleagues from the Manitoba Legislature, distinguished guests, thanks to everyone for being here, I think, for what is a very exciting announcement in Selkirk today. Thank you again, Minister Gordon, for your opening comments. It's a pleasure to be here today in Selkirk for a significant announcement about the future of healthcare in this community and within the Interlake Eastern Regional Health Authority. First off, I want to take this opportunity to thank the healthcare providers and staff across the province, including the many nurses, doctors, and healthcare support staff right here in Selkirk, who have worked tirelessly to provide quality care throughout this pandemic. Thank you for your dedication and commitment to patients and their families during these difficult times. I want to thank Dr. David Matier, CEO of Interlake Eastern Regional Health Authority, and Dr. Anthony Hurd, Site Medical Lead, Selkirk Regional Health Centre, and your health teams for being part of today's exciting announcement as well. Our government's bold vision for better health care focuses on reduced wait times, improved access, and more services in communities closer to home. And together we are taking another significant step in achieving that goal today. As part of our government's largest capital commitment in our province's history, I am pleased to announce today a $31.6 million expansion of services at the Selkirk Regional Health Centre. This investment will add 30 acute care inpatient beds, positions this facility to play a bigger role in the province's surgery and medicine programs while supporting the region's growing needs. The new beds will support more inpatients from across the region locally. These new beds will help enhance this facility's capacity to treat and monitor sicker patients. Surgeries performed at the site, which include general procedures, gynecology, urology, plastics, and endoscopy, will be increased as part of this significant expansion. This project will also include updates to improve patient flow, expand treatment capacity within the emergency department, and allow more residents in the community and health region to get the care that they need closer to home. Construction on this project is slated to begin next year, and I'm pleased to say that today's announcement supports our government's commitment to build, renew, expand our healthcare sites across the province, and improve the quality of care for all Manitobans now and well into the future. As identified in Budget 2021, our historic $812 million investment will support 38 projects in all regions of our province and forms the foundation of Manitoba's new provincial clinical network, a system of health services that will improve access and enhance the quality of and reliability of care while reducing provincial wait times. Other initiatives already announced as part of this historic commitment include a $70 million expansion of the Brandon Regional Health Centre, $283 million for a two-story new hospital in Portage la Prairie, $32 million expansion of the Bethesda Regional Health Centre in Steinbach, and $64.4 million expansion at Boundary Trails Health Centre in Morden Winkler. I want to highlight that an important component of this work is collaborative and meaningful engagement with Indigenous leaders, communities, and health experts across Manitoba to ensure we build an equitable and culturally safe health system that is accessible and responds to the needs and priorities of all Manitobans. Again, I want to thank you all for being here today. It's great to be part of a very significant announcement right here in Selkirk today. Thank you.
Thank you to Premier Stephenson and Minister Gordon. As the Premier and Minister said, Manitoba is transforming healthcare delivery to improve access and consistent, reliable healthcare across the province. Right now, along with our healthcare colleagues across Manitoba, we're working to ensure that people who need hospital care can access a bed while facing unprecedented demand for healthcare services throughout the healthcare system. Today's announcement will bring improvements to the long-term sustainability of the system and access to care regionally. Our region has played a key role in informing and ensuring that provincial planning takes into account our local realities as voiced through our community leaders, our residents, and our staff. Next, I would like to introduce our Selkirk Regional Health Centre Site Medical Lead, Dr. Tony Hurd, to say a few words. Tony.
Thank you, Dr. Mateer, and thank you, Premier Stevenson and Minister Gordon, for sharing this incredible news with us today. This is a really important step for Selkirk Regional Health Centre and the Interlake Eastern Regional Health Authority. It's one of many recent announcements of significant investments in healthcare that are foundational to the successful implementation of the Clinical and Preventative Services Plan. We're enhancing healthcare regionally, but we're also strengthening our provincial healthcare system, and this will benefit all Manitobans. Along with my colleague, Dr. Mike Loudon, who could not be here today, I am the region's medical lead for the Clinical and Preventative Services Plan. This plan is a coordinated, patient-focused investment in the health of Manitobans, and one of its goals is to make care available more readily in people's home communities. When clinical leaders and health system specialists across the province collectively developed this plan, we looked at what our region currently offers and where services could be modified or enhanced to better serve our population. This means building up services outside of Winnipeg so that patients who need care can have care delivered closer to home. Of course, there will always be circumstances where specialized care is required, and that will require transfer to Winnipeg, but creating more bed capacity in our region will allow us to be better able to repatriate patients to their home communities once they're able to return. Right now, our health center offers slates for general surgery, plastic surgery, gynecologic surgery, urology, endoscopy. And with today's announcement, it will allow us to increase the number of surgical patients that we can accommodate in the region. In turn, we anticipate that this jewel of a health center that has received national recognition for its design will attract more surgeons, specialists, and family physicians to the region. This is only the beginning of what looks like an incredibly bright future for Selkirk Regional Health Centre, and we look forward to continuing to build upon other important aspects of the CPSP. We will be contributing to improving health services and better aligning patient care with the needs of our population regionally and across the province. Thank you.
Well, thanks very much to Dr. Hurd. That concludes our agenda for the event. If there are questions related to today's announcement, they can be asked now. We'll then do a group photo, and there will be an opportunity for media to ask questions at that time. So thank you all. The start of it will be early next year, and within 2 years, so 2 years after that, so 2024.
What kind of work is ongoing to prepare staffing, recruit people to staff those 30 units?
All of that is ongoing. At the moment, we're working very closely with CPSP leadership provincially, and we have our local executive implementation team as well, so it's very coordinated. And as the Premier and Minister described, there are a lot of projects ongoing, so this is one of many, but we are making sure that we're integrated in our planning, and that will be about capital planning, equipment planning, staffing, etc., to coincide with the opening date.
Do you know roughly how many more staff will be required?
Maybe in a phased approach where we would have to determine exactly which of the surgeries are going to be involved in our expanded surgical program. And then build a surgical staffing plan and acute care staffing plan based on that, and according to the number of beds each of those would require.
Last surgery, I think there was mention of like it would improve emergency flow, or there would be improvements to the system within the hospital. Can you explain why expanding a bed-based surgery would improve emergency?
Well, I could, but Dr. Hurd is actually the head of emergency as well as the site medical lead. So, Dr. Hurd, would you like to comment on the ED flow of?
Certainly.
Yep.
Certainly. Could I ask you to repeat the question, though, please?
So I heard someone
Oh, okay. I mean, emergency patient flow is an extremely complicated issue that there's challenges all across the country in dealing with this. And one of the things that would improve patient flow is increased inpatient bed capacity to move patients who have been assessed in the emergency department and require admission into an inpatient bed more quickly. With increased surgical capabilities at the site, we anticipate there would be increasing numbers and increasing complexity of surgeries. And sometimes these patients need to visit the emergency department within a few days or a few weeks of their procedure because of an unforeseen event that should arise. So, you know, that plus many other factors that I could go on about all day, I think will improve flow in the department here.
What is the current, how's the current situation as far as the ability to move patients, you know, out of the emergency department? Is your department challenged right now in that respect?
Our department, like just about every department across the country, is challenged by that right now. We certainly have an aging population and increasing complexity of comorbid conditions. You know, the increased ability to treat things also leads to an increase in demand. And of course, this thing called COVID has certainly, you know, impacted our ability to move patients. I mean, the staff here have done a phenomenal job, like superhuman job to, you know, to move patients as efficiently as possible. But again, these are challenges all across the country. Actually, they're challenges in our neighbors to the south now, too.
Can you speak to some of the impacts that a patient faces when they do need to be moved? You spoke about the need to keep care in communities. But I wonder if you speak to some of those the impacts that happen when you have to move people out of their home community to get treatment that's happening right now.
I'm thinking I might defer that to Dr. Mateer.
Yeah, thanks very much. And just to add, actually, that I think Tony was not really explaining how much progress that he's made and the team have made in the emergency room question. We track a lot of metrics, just to add on to your answer, Tony, where we look at wait times, we look at length of stay for those people who are admitted, length of stay who are non-admitted, any bed blocks, and we have a task force. Tony's part of that, integral part of that task force, to look at flow through the emergency department. So a lot of work's going on behind the scenes, and we certainly are making progress. So thank you. Thanks very much for all of those efforts. And as far as patients moving out of the region, it's ideal that if we can provide care within the region and provide the services needed within the region to the residents of the region. Of course, that's limited by the types of care that we can provide here. In a rural area, we clearly can't support tertiary care or quaternary care, specialty and subspecialty kinds of services which are provided in Winnipeg. So our residents will, at some point, if they require complex care, have to leave the region. But what we intend to do is to provide care closer to home and keep patients and our residents in the region by providing better and more robust primary care and community care services, and also providing capability and capacity in assisted living and supportive housing, as well as acute care and as well as personal care homes. So we're trying to provide that. That is part of the CPSP. In the interim, I think where your question is directed is, yes, there are impacts. There are family impacts. There are personal impacts for people that are leaving the region necessarily to be placed in other facilities that have capacity within our province. We recognize that. We try to match the needs of the care of the patient with the site where we have capacity in the region, and we try to communicate that effectively with families and patients, and obviously driven by the medical needs and the medical teams at both sites. But we absolutely recognize their impacts.
On the subject of transfers, possible patients in Interlake are being transferred out of region at a greater rate than we're seeing patients in Winnipeg. What do you think is behind that higher transfer rate?
Well, we're certainly doing we're trying to be as efficient as possible, let's say that, through our incident command process. Our incident command has been set up specifically to look at the operations in our healthcare system and the efficiency within our healthcare system. What we're trying to do, as everyone knows, is create capacity in the acute care facilities across the province. And we're doing that by taking those patients, assessing the needs of the patients, and then those patients that don't require acute care, then identifying where else they could be cared for appropriately, in a more appropriate setting with more appropriate staffing, etc. We're clearly doing a reasonable job of that because we are reducing the number of alternative level of care patients, which describes those patients that don't need hospital care, that are in hospitals. And so all I could say is perhaps our incident command is working quite well, and we are managing to create more acute care capacity. That's important, not just for people in our region who need acute care treatment and access to acute care, but also to help other parts of the healthcare system, such as Winnipeg, repatriate patients back to our region where they come from, in order to be able to create capacity there so they can continue the surgeries and continue to admit patients to have the care that they require, both in Winnipeg and referred from other areas in the province.
This may be towards Mr. Gordon or Mr. Stephenson. Are similar investments going to be made in other health authorities? I'm thinking of the north, where there are very few available healthcare facilities to address the needs of communities. Many of them have to actually travel to Thompson or actually go to Winnipeg. So I'm wondering what the plan is there.
Sure, thanks very much for that. And we are looking at, this is the overall project package is, it's 38 projects and $812 million in total. So this is yet another step in the right direction, and we will be making an announcement soon with respect to northern Manitoba as well as other areas as well.
Minister Gordon, this expansion will obviously take a while to complete. What do you have to say to families or people who are currently waiting for really crucial surgeries and need something, who need help quicker?
Well, what I say to those individuals is that we're taking a very provincial approach to many local issues, and as Dr. Mateer mentioned, we are engaged with other regional health authorities in discussions around the needs, and we take very seriously as a government our commitment to provide Manitobans with the surgeries they need, as well as their diagnostic tests, and an announcement is forthcoming on that work. But this is something we take very, very seriously as a province. I have many communications on an ongoing basis with the CEOs of all the regions and the clinical leadership team, and we all share in the commitment that we need to deliver on surgeries and diagnostic tests as soon as possible.
Other topic, we'll do that after.
Thanks very much. That concludes the event, so we're going to have a group photograph, I think. Thank you.